Hi everyone, I'm Carilion Clinic's Karen McNew, here today with Dr. Anthony Baffoe-Bonnie, Carilion Clinic's Medical Director for Infection Prevention and Control, and we are here to talk about COVID-19, what you know as the coronavirus, and a lot of the questions you have for us. So thanks for joining us, Dr. Baffoe-Bonnie.
Thank you, Karen, for having me.
Okay, so let's get right to some of the questions that people have sent to us, and the first one being, what are coronavirus symptoms?
Okay. So I would start off with what is coronavirus to begin with. Coronavirus is a common virus that humans have lived with for hundreds of years. It's called the human coronavirus. It causes the common cold. Usually we see it during the fall and winter months. However, this new coronavirus, the COVID-19, or we call it also the COVID-19, causes symptoms which are significantly worse than the usual human coronaviruses that we know about. So the symptoms that it does cause include fevers, chills, cough, some shortness of breath, and that would be in the majority of patients. It would be mild symptoms. For other patients, a minority, about 15%, the symptoms are severe and can include respiratory failure.
And that is what is causing some people some concern in that small percentage of patients. When people say it's just like the flu, is that true? Can you make that comparison?
You can, and at the same time, you cannot make that comparison. So it's just like the flu or really any other respiratory symptom because of the type of symptoms most people have. It's probably very difficult to differentiate it from the flu given the type of symptoms persons may have, which again include fever, cough, shortness of breath, URI symptoms, muscle aches. However, it's different from the flu in that especially in elderly people, the death rate is remarkably higher, and we do not have any cure or vaccines for it.
And we're sure work's being done on both fronts likely. We have this question from someone who asked, is it really that bad?
So yes, it is a condition to be aware of and to plan for so that knowing its death rate, we are able to put actions in place to mitigate how bad it is. So nothing to be really scared about, but something to plan about.
And then Dr. Baffoe-Bonnie, you touched on this with the answer to our first question, but who is most at risk from coronavirus for having the most negative side effects?
So the person who is most at risk from coronavirus based off current studies include our older population. When you're above age 60 and with each age or with each decade, there is an increased risk that goes on. There is also increased risk when you have medical conditions that already put you at risk of death if you do have any medical condition on top of that. And those medical conditions can include severe asthma, heart and lung disease, uncontrolled diabetes.
And then we also have another question. We were talking about the ages, and as you get older, your risk for more severe complications can increase. Someone who says, I'm 69 years old with asthma, do I have to really stay at home?
Okay. At this point in time, it depends on the community you stay in. So if the community you stay in doesn't have any community spread coronavirus, then being mindful of where you go, making sure that one washes their hands when you go out, having alcohol sanitizers to use intermittently as you touch different things would be prudent. Also, avoiding large crowds would be prudent too. But staying at home just because there is coronavirus in the US doesn't really make sense. It has to be whether you have it in your community or not.
great perspective, Dr. Baffoe-Bonnie. We see a lot of people wearing masks. We've heard people trying to buy masks. When should people be wearing masks?
Masks don't really help if you don't have coronavirus in your community. It actually increases the chances that you'll be touching your face, fixing it, trying to move it around. And so there is no data to suggest that masks are helpful. It is helpful if you're a healthcare worker to use the right type of mask. Also, when you do have a respiratory condition and you want to protect your loved ones as well as the people around you, wearing a mask to decrease the trajectory of your cough is helpful.
A lot of people may have trips planned, and so they ask, is traveling a good idea or a bad idea?
I think the answer is it depends. Depends on where you're traveling to. So the CDC, especially Dr. Tony Fauci, talks very eloquently about the fact that going on cruise lines at this point in time is not probably a very good idea, especially if you are elderly or you have medical conditions that would increase your risk of having a bad outcome if one had coronavirus. If you have to travel to an area that has high coronavirus incidence, let's say in Italy or Germany or South Korea at this time, I don't think that's a good idea. The CDC does have a travel website and discusses the levels of threat, and usually you would want to use that just about the time you're going to travel to determine whether it's a good idea to travel to those areas or locales. And that would be the best advice as to how to know when to travel in the US as well as outside the US.
Okay, and then a lot of people have already preemptively canceled events in different communities. This question is, should we think about canceling events?
Again, it depends really on the size or the number of people who are coming to the event. It depends on where the event is going to happen. It depends on whether you're expecting international people from different countries coming in. Those are all factors and features one should use to determine whether there is a need for cancellation of events or not. Some people have actually big event organizers have actually gone on and used e-events or electronic events as a way of bridging the gap when they want to share information. And these are things that are plausible and can be done.
Okay, this is an interesting one. Can I make my own hand sanitizer?
I'm not an expert in chemistry, and I would suggest we use the commercially available and proven products with 60% alcohol or more. But I would say this though, hand hygiene is best with washing of the hands with soap and water. 20 seconds, good rub, gets it done.
And so as we continue to hear about numbers being updated of presumptive cases in Virginia, the next question is there much risk here in Virginia?
Okay. So at present, as we talk, most of the cases that have been identified in Virginia are exported from outside. In other words, even though the number of cases identified in Virginia have gone up, we haven't yet seen community transmission of coronavirus at this time. This means that we have enough time to plan. That's important. Planning to decrease or mitigate any possibility of community transmission is the most important thing.
And we know that we have been doing quite a bit of planning, which leads us to the next question. Does it look like it will end up in our area? And I know you don't have a crystal ball, Dr. Baffoe-Bonnie, but I think that's on the minds of people in our region and in Virginia.
So part of the planning that the health system does is to help decrease any risk of it ending in our area and becoming a community transmission or taken root and having community transmission. Therefore, simple actions like hand washing, very, very important. Actions like coughing into tissue or into the inside of one's elbow when one needs to cough are also very important actions that decrease transmission of infections. When you're sick, going to see your doctor, and it's important to call ahead of time and let them know of your symptoms so they can direct you to the right place, be it urgent care or your doctor's office. That's also very important. Staying away from other people when you are sick, also very important. And not going to work when you are sick is also, these are simple but very effective ways that other countries have used to decrease the transmission when they've had local transmission. And we should be practicing that now so that if this disease and when it does show up, we are able to quickly stop it.
And I know, Dr. Baffoe-Bonnie, you have been part of a multidisciplinary team from across our health system, meeting regularly since the very beginning to plan and prepare. And that leads me to the next question, which is, how is Carilion preparing?
Carilion is preparing in multifaceted manner to help, if we are to see a case, decrease one, transmission in the community, and then to protect healthcare workers when they show up in a facility. And this is really a multidisciplinary sort of work involving all our regional hospitals. One of the first things we are doing is trying to, one, identify patients who have the appropriate epidemiological risk as well as symptoms, and direct them into a care stream that minimizes their exposure to other patients as well as to healthcare staff, unnecessary exposure to healthcare staff, or exposure to healthcare staff whereby they are not wearing the right PPE. That's one thing we are doing whilst we triage patients or whilst we schedule them. Another thing what Carilion is doing is we're beginning to educate our staff about certain things to do when a patient with suspected coronavirus comes into the facility. We will be holding simulation exercises with regards to transfer of a patient from, let's say, the emergency room to the regular floor. We will be holding other exercises as well with regards to retraining on PPE use, just to make sure that everybody is up to snuff in that area. We are holding exercises with our EMS or giving advice with our EMS group about when they receive calls with regards to patients who may have symptoms consistent with coronavirus. Another thing we're doing is working with our urgent cares and velocity cares. We expect that most people, when they have symptoms, because the majority have symptoms that are very mild and look like the flu, will likely come to the urgent care centers. Our hope is that one of the things we're doing is trying to make sure that patients get to call ahead of time so that they are able to be streamlined in terms of taking care of them there.
Would that be an instance where if someone suspected, I might have symptoms, I've traveled to an area where there are a lot of cases, would they basically give that urgent care a phone call heads up?
That is what we are trying to put in place, such that these urgent cares are aware of this earlier on and they can put in the appropriate things to take good care of the patient.
And you mentioned PPE, which is personal protective equipment that our healthcare staff use. Our next question is, will clinical staff receive training to prepare for COVID patients? And you talked about the simulations, and I think that's important for our audience to know that we have been practicing what we will do if, in fact, we are presented with one or more cases of COVID-19 coronavirus.
That's exactly right. That's very right.
And then one final question, just wondering about symptoms. So we know when symptoms may or may not show up with flu. If someone's infected, how long does it take before they start to show any signs?
So the typical incubation period is thought to be between 2 and 14 days if they're going to show symptoms. The average duration for incubation period has been seen to be between 4 and 5 days.
And so as a final thought for people who've been watching Dr. Baffoe-Bonnie, what is the most important thing you would want them to take away from our conversation?
I think the most important thing is we have some time, and this is the best time to do a lot of planning around, when you are sick, making sure that you have the number to call your provider ahead of time. And so those are important things to be aware of. Planning around if, let's say, their schools get closed, who's going to take care of kids. Those are things one wants to put in place and ahead of time. And as a health facility, we're also doing lots of planning with regards to how to mitigate any community transmission. And more of that will become available as time goes on.
And certainly we want to spread facts, not fear. We thank you for joining us for this conversation, and we hope you found it useful. You'll find all of the most updated information about coronavirus, COVID-19, and Carilion Clinic's preparedness at carillionclinic.org/coronavirus. Thank you so much, Dr. Baffoe-Bonnie, for joining us.
Thank you very much, Karen.